Hello, friends. After Dr. Chinmaya, wonderful session, practical session. Now we are moving on our academic session 8 of first International Kinesio e-conference, and now we have with us one of the dynamic physio of India, Dr. Swapnil Mate. He is the certified kinesio practitioner to be solely based in India. He has been associated with Indian shooters at London 2012, Rio 2016, and upcoming Tokyo 2021 Olympics. He was also associated with pro kabaddi teams like U Mumbai, Bengal Warriors, Indian Super League football team, Mumbai City Football Club, and Indian boxing team in World Series hockey. Presently, he is serving as an international instructor at HPE UK London. Now we have his topic. He is going to take the lecture on application of kinesiotaping technique on lower limb injuries in elite runners. Now over to you, Dr. Swapnil Mate. Thank you.
Okay, thank you, Dr. Ankit, for the firstly to invite me for this first international conference on kinesiotaping. I would also like to congratulate for your kind initiative and the hard work and effort which you have put in organizing such great symposium on also targeting a good kinesiotaping practitioner across the world to showcase their talent and the hard work. So, without wasting much time, I would like to present my topic today is basically a kinesiotaping application in elite runners. I'm Dr. Swapnil Mate, sports physical therapist practicing at HP UK Healthcare London and as well as in Bombay. So I like to keep this topic very short and simple so that you can understand and try to be a little attentive as we are going to go forward with most of the protocols which we are going to use in all stages of rehabilitations. Okay, so my today's topic is the kinesiotaping application in the elite runners. Okay, to give just a disclaimer, this is just for the educational purpose. We are just showing you an overview of the taping application. The images what we are going to show in this particular presentation is purely not to endorse any kind of institution or their brands. The taping application should be only performed on patient after taking a good hands-on workshops. And this webinar certificate does not give you permission to practice taping application on patients. Okay, so let's get started, guys. Okay. The kinesiotaping application founder, Dr. Kenzo Kaze, he's a doctor of chiropractic applications. Now, basically, I had got a good opportunity and I was very much lucky enough to meet him in the polyclinic at the London 2012 Olympics. We shared quite a good amount of rapport in discussing various different techniques application, and he really put me a backbone in getting me the good hands-on technique about how to use the taping application in various different sports. Okay. Now coming to our topic, I have basically categorized the most common injuries in runners. I've classified the running injuries basically in the lower limb into three categories. The first one being lateral knee pain, second one being the anterior knee pain, and the third one being in the lower leg, that is just shin splints. In a lateral knee pain, we are going to talk about a syndrome which is most commonly seen in a running athletes, which is the IT band friction syndrome. That's a new terminology. In the anterior knee pain, we are going to focus on two particular conditions which we commonly seen in the elite runners. The first one being the patellofemoral dysfunction, and second, a combination of PF dysfunction with the patellar tendinitis. And the third, most common in the lower leg, is the shin splints. Okay. Before applying any kind of kinesiotape, it's very important that you understand the pathomechanics of the sports, also the pathophysiology of exactly how the condition happens. In this particular presentation right now, we are going to talk about the IT band friction syndrome that is classified under the lateral knee pain. So lateral knee pain, the pain around the lateral knee joint is the most common presentation, especially among the distance runner. This happens because of the repetitive knee flexion and extension range, during which the IT band rub against the prominent lateral condyle of the femur. Now, this could be ideally because of any training error or biomechanical abnormality which can precipitate IT band friction syndrome. There was a research done a few years ago between the association of IT band injury status and the running biomechanics, how it changes the entire running cycle in women athletes when you suffer from iliotibial band friction syndrome. Now, lateral knee pain, I'm going to talk specifically on the IT band friction syndrome and the supratrochanteric bursitis, which is usually formed because of the tightness of the IT band. Let's get into a little bit of anatomy. So the gluteus medius fibers combines with the tensor fascia latae, forms a IT band and insert onto the lateral condyle of the tibia. That's a Gerdy's tubercle. IT band, do not mistaken, it's not a muscle, it's majorly constituents of the fascia. However, the muscle which unites it is the G medius fascia fibers combines with the TFL fibers. Both unites, forms an IT band and insert it onto the lateral side of the knee joint. From the anterior aspect, if you see, the IT band is separated with the femoral condyle with the help of the secondary structures, which is the bursa. Now let's get into the mechanics of how exactly it happens. So before understanding any kind of lateral knee pain, let's go through the pathophysiology of the IT band friction syndrome. So as we know, the gluteus medius fibers combines with TFL, it unites together to form an IT band. Whenever you have any kind of overuse by doing the same activity repeatedly, the tight gluteus medius and TFL leads the IT band fibers to get shorter in length. Tightness in these fibers causes the IT band to mechanically shift in the proximal direction and in the anterior direction, which puts more pressure distally at its insertional point. The reason why it happens, the tightness of the IT band, is because there is a repetitive knee flexion and extension in the range of 50 to 30 degrees. Whenever athletes perform this regular knee flexion and extension below 30 degrees, either in the downhill direction or walking on an uneven surface or on the hard surface, the IT band goes into shortening because of the tightness of G medius and TFL. Understand that? So when the IT band gets tight, it rubs against the connective tissue. Now this connective tissue could be either a periosteum, so it will cause a friction between the IT band and the femoral condyle, giving rise to disruption of periosteum, giving to excruciating pain on that particular localized area. Or there could be a presence of secondary bursa between these two structures, that is the IT band and the femoral condyle. Now, recent advancement or research papers article has suggested, earlier it was thought that the periosteum was basically a factor responsible for generation of pain. But a recent MRI and ultrasonography has suggested that there is a presence of secondary bursa between the two structures, which often leads to other signs like tenderness, swelling around the lateral knee component, and sometimes you get a presence of crepitus in between the two. These are the few research articles which suggest that if you have an IT band tightness, it can also lead to a tightness